Well, low vision rehabilitation is when you have two eyes that are affected by a disease. So if it's macular degeneration, both eyes have it and are causing some kind of impairment in both eyes. Then you would see me or someone like me who provides this kind of service. And our goal is to see what kind of vision you have, find the best areas of your vision, and then work to maximize it or enhance it. All of that so that you can enjoy life to a greater degree. And that might be so that you can read small print again. For some people, it may be leisure activities like watching TV or going to the Angel game. But it's daily life. So when someone sits down in my chair, we just talk about what do you do during your day and what do you limit it by. And sometimes they'll say, well, I just want to see better in general. But my goal is actually to get us to identify some very specific things that we can work on. So let me explain a little bit more about macular degeneration and how it impacts daily function. So as Dr. Cooperman was talking about the retina, it's a very good description of the room, and I'll probably steal that in my explanations to patients about anatomy of the eye and the retina and so on. It does just affect the macula. The good news is that you never go totally blind. And that is a question that people don't always ask. Maybe we assume it as the doctors, but it does not impact that peripheral retina, which means that you still have peripheral vision, good peripheral vision. And that means that we can navigate and walk around. There's still some issue, again, with being able to see elevations, and so the risk of falls with macular degeneration does go up. But peripheral vision overall, in the simplest form, is fairly good. So we'd evaluate that blind spot. We'd also look at what's called contrast sensitivity. And that has to do with that lighting. So when contrast is suppressed, which is true most often in macular degeneration, and even in the aging eye, our ability to see contrast, which is shades of gray, is quite suppressed. Macular degeneration, even more so. So that means we need more lighting to try to see the differences in grays and colors and so on. So we would talk about that and even explore the level of contrast sensitivity loss. Because at the end, when we're talking about what are we going to do, of course, lighting is going to be a really important thing. Magnification is a really big strategy. So we can do that with optical devices, and we can also do it with video magnification technology. So this is an example of those telescopes that might be on the outside the eye, on the glasses. So people can actually drive with these. Not everybody can drive with low vision, but within a certain realm, you could get a restricted license, and so we talk about driving if that's something that's important. And these would be something where you would be driving, let's say, or walking, because it's not in my way of the ground. But then I would tip my head down in order to see faces. And maybe you can see even my eyes are a little larger as we look through there. My view of you as the user is larger as well. So I can see 2 times closer or 2 times larger. So then there are filters that we might explore which help us with glare management. So the problem is although you might have difficulty with not enough light, so we need more light, the wrong kind of light coming into your eye in a certain direction causes glare. And that's a big problem for macular degeneration. So you don't like the wrong kind of light, but you need the right kind of light. So managing that is what we're going to work with both our community partners who go into the home to help you with that, and also in our evaluation when we talk about that and explore. So all in all, vision rehabilitation is about enhancing the vision that you have, but we have to establish what that vision is. And it goes a little bit beyond looking at the anatomy of the retina and the different parts of the eye. It's looking at vision function, how your blind spots are affecting you, how your both eyes working together affecting you, how contrast loss is affecting you, and then what you do during the day. For some people, it's really important for them to read. For others, it's not important at all. So we really want to pick the things that are most important, find the right tools and connections to be able to help people do that, and really connect with our community partners to make sure that whatever we recommend goes and changes lifestyles with you. So it's not just a pair of glasses that I do or don't use, it's really incorporated into lifestyle so that it's a new way of doing things.